Hey, welcome back, folks. This is Kenneth McNulty here, co host of the Lab Life podcast. And today I'm joined by my other co host, Michelle Miller.
Hey everyone. Hey Ken, nice headset.
I appreciate it, like yours too. I heard we're here for a pretty special reason. Could you kind of go into that?
Yeah, so we're here at home due to the COVID-19 pandemic. Normally, we would be in a National Harbor, Maryland this week at the Air Force Association's Airspace and Cyber Conference. But instead, Afrl is having a virtual presentation and a virtual booth for all of our fans and followers. You can check out afresearchlab.com for more in-depth information. But today, you and I are going to have some really cool conversations about what Afrl is doing to support the Air Force and Space Force in the fight against COVID-19. And we have some great professionals from our 711th Human Performance Wing, as well as our materials and manufacturing directorate and other areas of Afrl's. So, listeners, stay with us and hear some amazing stuff that our scientists, engineers, and professionals are doing to keep you and the Air Force and Space Force professionals safe.
Let's get into it.
So, Dr. Naik, thanks for joining us today.
Thank you, Michelle. It's a pleasure to be here.
So today we're really exploring, AFRL's response to the COVID-19 crisis. You're the chief scientist in our 711th Human Performance Wing. Can you kind of explain to our viewers what your role is and what your job is?
Yeah, so my role in the 711 Human Performance Wing and part of the larger AFRL and the Air Force ecosystem is to provide, technical guidance to the commander on our technical activities that's supporting Air Force priorities and strategic drivers, identifying technological solutions that can address some of the gaps and challenges that have been identified through our various partners. In addition to being part of AFRL, we also have a functional alignment to the Air Force Surgeon General. So we also address, the Air Force Medical Service needs that comes in through the SG's office as part of the larger Defense Health Agency activity. So I think that from my perspective, where I sit as the chief scientist of the wing is to ensure that we have a cutting edge S&T program that supports both the medical as well as the line mission of the Air Force, ensuring that we are aligned. Technical programs are of high quality and have technical rigor, and that's sort of my responsibilities here at the wing.
So you can really see that broad overview of how AFRL is supporting so many parts of the Air Force and our warfighters and our nation in this response. And, across AFRL, we're providing support, but, the wing has really been a focal point. Now, how are you managing your COVID-19 response with your everyday mission?
Yeah, well, our commander has, as well as AFRL commanders, has provided us guidance that we need to provide, support for COVID-19. It is a priority for us and for the nation and for the Department of Defense at large. So we have been pivoting some of our activities to support COVID-19. And I've been fortunate to have, some excellent folks within my organization and my office who are dedicated to addressing COVID-19 related issues. We set up a COVID-19 innovation cell back in March as the COVID-19 pandemic was gaining steam because we were getting a lot of requests from all over the community about technology solutions. People would contact us and tell us, hey, I have this really cool idea or a cool device that can disinfect or can detect COVID-19 or SARS-CoV-2 particles. Is this of use to the Air Force and the DoD? So we stood up this cell. To date, we have addressed close to about 300 requests that have come in through different sources within the Air Force, from outside the Air Force and the DoD, as well as academic and industrial partners that have reached out to us and we've been trying to do some technical assessment, but also provide some matchmaking. If we did identify a solution that can address a problem, trying to identify, the problem owner and connect the two. And I see that, that has been, I think, one of our our efforts in the past 6 months or so, but also looking internally to the organization in AFRL and the wing, what do we have within a kit that can help support address current COVID-19 operations, or from an R&D perspective, more longer term, because we do have R&D activities that address a longer term piece, but we also have things that we felt that we could apply towards COVID-19 currently. As most of you know, our epidemiological lab here at the School of Aerospace Medicine that has been doing, I would say, testing and surveillance as part of their mission has been supporting COVID-19 testing. They've crossed the 100,000 mark of tests they've done for COVID-19. So samples coming from the medical treatment facilities, from bases around installations around the country, and even overseas. They get analyzed here in the School of Aerospace Medicine, and we've been doing COVID-19 testing since the beginning of the pandemic. In addition, we have, because of our consultation role, lots of questions that's coming from the field about, aircrew safety and other things. How do you develop, protocols and provide guidelines to the operational community if you had someone with COVID-19? How would you also disinfect environments? What kind of tools that you can use to disinfect? As well as, if we had to transport patients in aircraft, which we do as part of our XQ mission for the DoD, as part of the aeromedical evac response that we provide for the DoD. If we brought patients back, how do you protect the aircrew, but also how do you ensure you can decontaminate the aircraft in a timely fashion so it can turn around and carry out the next mission. So we have all these different pieces and expertise within the organization supporting, current operations in COVID-19, and also some technology solutions that we have pivoted towards supporting COVID-19. And I can get into that in a few minutes, a little more detail behind those work as well.
Yeah, that's a great overview, and we're going to have the opportunity to speak to some of your experts on, the Epilab and some of our partners in, aircraft decontamination. So that's a good overview to see where we're coming from. What are some of those other projects that your team is working on that you feel are really important during this time?
Right. So we have across, I would say, across enterprise or enterprise level activity that involves multiple directorate on using explainable AI to develop a modeling approach to how you would forecast COVID-19 disease progression. So as most of you know, there have been a lot of dashboards that have been used, famously by the White House and the state governments on showing, predicting, the cases, and also, how would you flatten the curve, those kind of things. So what we have been doing is the team here at 7-Eleven has been working with the other TDs, directorates within the AFRL, on developing what we call as explainable AI approach. So how would you use an artificial intelligence approach to simulate, use data sets using simulated models about the progression of COVID-19, using established epidemiological models, but adding new bells and whistles to it. So for example, we have developed in collaboration with MIT Lincoln Labs, developed a library of 500 million data sets or scenarios. So if you did non-pharmaceutical interventions like social distancing or staggered work schedules or other things that we might normally use within our communities, how does that impact COVID-19 disease progression? And that's one area that we have been supporting the Air Force as well as other government agencies by giving them that tool, making that tool available that is developed by the government, is free for use for others within the government to help with modeling of COVID-19 and what some of the interventional strategies and surveillance and what would be the impact on disease progression in that community.
That's really interesting.
Yeah, and from a more longer term perspective, I think we have some really cool work that's going on in collaboration, for example, with Directorate Energy Directorate, where can you use other approaches to disinfect or inactivate the virus, right? Most famous one you must have heard is using things like Lysol or other things that disinfect the virus, which is a chemical-based approach. There are also things you could also use other aspects. You could use light. So UV light is normally used, but that's not very safe for humans. When you're disinfecting an area with UV, you don't want to walk into that environment. But can you use things like directed energy, microwaves, and other things that might be safe for humans, but effective against inactivating the virus? So we've been looking at some of that technology as well in collaboration with other technical directors within the Afrl on how we could maybe implement an RF-based approach to inactivate SARS-CoV-2 as we have some of those, I would say, tools available within the organization. And then, there's a lot of interest on how would you identify things without having to go and get a nasal swab done. I mean, that's how you do most of the testing today is you have to go get tested, they stick that nasal swab in and then get it out. Yeah. Very uncomfortable, right, to some people. But are there other things you can monitor that might give you an indication of maybe there's some pre-symptomatic markers of COVID-19 or respiratory illness in individuals? So we've been leveraging work that we've been doing in monitoring human performance. So wearable devices like your Fitbit and Apple Watches and Garmin watches, they measure specific signals in individuals. Can you take that in combination with an algorithm and identify those individuals that might have some respiratory disorder or illness, right? So you can't really differentiate between COVID-19 versus the flu. But can you then identify those individuals who might have respiratory issues? And then if you want to take those individuals and test them and see, okay, do you have the flu or do you have, COVID-19? Then you can bring some of the clinical grade diagnosis to do that. So we've been developing what we call wearable devices and apps to monitor, health of individuals and also look at other pre-symptomatic markers that might be present in breath, right? We know that, under certain conditions, the chemical composition of breath changes, and there could be things that in your breath that may be indicative of COVID-19, and that's a research that we're doing in collaboration with, for example, the Materials and Manufacturing Directorate, but also with IARPA.
Yeah, that's really fascinating. I think that the diagnosis and the testing, I mean, obviously that's been in the news, and the only way that things get better really is more rapid diagnosis. And how great would it be if you didn't have to have that nasal swab up to your brain? And I know there's many different ways that we're testing and different efficacies and accuracy rates for those testing methods. But if someday it was simply that I have on my smartwatch and it's already monitoring, I guess, my heart rate variability and my pulse and maybe some other, metrics that I'm not even aware of, that could tell me like, hey, you might want to get checked out. That's really fascinating.
Yeah. And I think that's what's unique about Afrl and the wing is we have, some really smart folks here that have creatively been thinking how they can apply some unconventional technology solutions to address the COVID-19. And I think that's the silver lining from all of this has been that, I've seen the creativity of a workforce that has been put to really great use here in terms of addressing the COVID-19 crisis and coming up with some very unique solutions to support, whether it's from a force health protection, from a decontamination perspective. We have some work going on decontamination, right? How would you decontaminate the surface of an aircraft, high contact areas and other things? You can't use the same solutions that you use in your house, like Lysol and other things, because they tend to be a little corrosive on sensitive aircraft material. So you have to come up with different solutions. Again, some of our as scientists and engineers here have been coming up with some solutions to solve some of those problems. Like cooking a plane. You must have read that in one of our publicly released articles on how we're trying to increase the temperature within the inside of a plane so you can cook it and kill the virus, right? So again, creative ways where you're not using a chemical or a corrosive agent to disinfect, but you're just using heat and a little bit of humidity in those environments to inactivate the virus.
And one thing that I think is so phenomenal about our team, and also reassuring as just a member of the general public, you know, I'm not a scientist or engineer, is that our team has been working on problems in knowing that a pandemic could happen, or just that there's other, you know, whether it was Ebola before that we worried about cooking out of an aircraft, or anthrax or something like that, that we've been working on this problem. And now that our minds are adapting and shifting to the present day problem and how we can apply current technologies and technologies that, you know, everyday things like the wearables that you mentioned to solve our current problems. And then of course you're mentioning about the R&D for the future, you know, setting ourselves up to succeed for a long time. That it's phenomenal what our teams are, how they're pulling together. And are there any perspectives that you've gained from being in your position since this pandemic really broke loose and it started impacting our everyday lives?
Yeah, I think one of the I think what I've learned to appreciate quite a bit is the ability of, you know, the larger community to come together in a rapid fashion, right? You know, when initially the pandemic was sort of the outbreak happened, you know, we were a little confused on how to organize and address and mobilize ourselves to address this pandemic. But in a very short period of time, you know, the Department of Defense, the Air Force, we all came together and started solving the problem in a very rapid fashion, right? We're clearing things very quickly, building relationship, partnerships, the academic and the industrial community, and coming in, you know, and saying, hey, I have a solution, you know, that can help you, without any regard for, hey, what's the financial return for that organization. They were willing to provide in-kind support to help address this pandemic, because we know from a national security and defense perspective is important, you know, that we beat this. And from that perspective, I think it has been really, I would say not just eye-opening, but I think I feel really good where the country is, and seeing the goodness that's coming outpouring from the community to support the organization. And for me, that has been sort of a takeaway from the pandemic. And not to mention, you know, with us working from home, you know, the challenges of working virtually, people with families and kids, you know, people putting long hours into supporting the COVID-19 response. Again, that is also, I think, is something that I think it's hats off to our SMEs to be able to, you know, work through all that and provide, you know, I would say top-notch advice and expertise, trying to be the smart buyer when we're looking at technical solutions. We're also providing guidance and support to the larger community.
Absolutely, it's been amazing to see the response and people step up. I mean, we have, obviously we're a civilian heavy organization, and with several active duty members too, but you know, stepping up to be part of the fight against this pandemic it's been amazing to see.
Absolutely, and you know, it's both our military folks, contractor staff, you know, the civilians, all working together as a team. I think that's what I think has been very powerful. And you know, we tend to sometimes take for granted the horsepower that we have within the Afrl, because we are spoiled with having, you know, such I would say exceptional talent with the organization. It's times like this when you see us shine, where you see that come out, is because you can quickly get a team together that can solve a problem and provide, you know, solutions in a rapid fashion. And I think that to me is also a critical aspect of Afrl that we tend to take for granted, because, you know, we live and breathe this, but not everyone is as fortunate as we are.
Very, very true. We have a phenomenal team. I like how you put it, the horsepower that we have, that we can really hit the gas on an immediate need if we need to. And I want to thank you for joining us today, giving us an overview of how Afrl is playing in the COVID-19 response. And we're looking forward to talking to the rest of we're not the rest, but a small fraction of the Afrl team that's helping in this response. So thanks for joining us.
Appreciate it, and have a good day. Thank you.
Wow, Michele, I got to say that was a great interview you just had and very inspiring. So do you know who we have next?
Well, let's find out, Ken.
Hello, folks, and welcome. Today we are joined by Senior Master Sergeant Minton Leader. He is the Superintendent for the Epilab services. Thank you for joining us today.
Good morning.
So starting off, can you kind of describe what that is? What does it mean to be the Superintendent for the Epilab?
Okay, as the Superintendent, I oversee all the manning and personnel for the Epilab, and we're located in the United States School of Aerospace Medicine. And then I work along with my division chair to drive the strategic vision of the Epilab.
So going along that line then, what does the Epilab do for AFRL and the DoD?
Okay, so for AFRL and the DoD, Epilab is a lead testing site for COVID testing, and we're also a DoD reference laboratory. So we do all of the Air Force HIV testing, individual medical readiness test as well. And also we do a lot of testing here that would be expensive to do in the civilian sector, and we bring it on for our Air Force sites at a lower cost. So we can collectively recoup that testing for the Air Force and save the DoD money in general.
So a big question we want to ask today, our conversation was centered around the AFRL response towards COVID-19 and the current pandemic. And with the Epilab being so important to that, like you mentioned,
Yes.
What does it look like? How has that changed your day-to-day here the past few months?
It's been crazy to say the least. Within 12 hours of starting on the pandemic, we went to 24-hour operations and brought on more personnel, cross-trained multiple personnel into different areas to kind of plug and play if there was a need or an illness, and to extend over a 24-hour time period. Yeah, so we have currently 106 people working in the lab throughout a 24-hour operation. So.
And with this new amount of people that you've brought in, how many samples are you seeing a day just related to COVID-19?
Normally, it's about 2,500 to 3,000. On average, per week, it's around 8,000. And then overall, we've done 108,000 COVID tests.
And with these COVID tests, what's the goal with the data? Are these supposed to send out to different bases to let them know where like these places are being tracked, or is this just helping to make sure you know where these COVID cases are coming from?
For Epilab purposes, we are performing the COVID test, and then that the result gets put into the patient medical record. But then local MTFs and our public health team here as well, they crunch data and numbers, and they're able to determine if there's an increased positivity rate at certain locations.
And with all these the tests coming in and a lot of these new folks coming in to help you, what are some lessons learned you have since the pandemic started?
Balance. We've been going strong for the last 5 months. So we got to keep the mission going, but we also have to, it's rest when you can, the work rest cycles. Also training people on multiple different things. That way, if by chance someone is sick, or when someone becomes sick, then that can possibly quarantine a group of people. So in order to prevent complete mission stoppage or delay in testing, we really have worked on cross-training people into different sections within Epilab so that they can plug and play as needed.
Wonderful. Well, thank you so much for joining us today. That's very insightful.
Thank you.
Great conversation, Ken. Let's talk to our next guest now. So now joining us is Rachel Kraybacker, a materials engineer with AFRL, and Caitlin Bojanowski, a biological scientist at AFRL. Ladies, welcome.
Thank you. Thank you for having us.
Yeah. It's great to be able to catch you during a busy time. You both work on Afrl's decontamination team. What does that mean? Because I'm just picturing people in hazmat suits right now.
It's what a lot of people picture, I think. Basically, our response was through AFRL. We were kind of called upon from AMC and AFL-CMC, basically as how can we decontaminate aircraft in a short time frame and making sure that we are maintaining the integrity of the materials on the aircraft, right? So killing the viruses as well as making sure we can use the airplane for many years still to come afterwards.
So going along that train then, you mentioned there's quite a few methods you've tested out, different technologies. Have you found some that are very successful in combating the COVID-19 and other deadly viruses on aircraft?
So the method of using high heat and high humidity to decontaminate aircraft is something that actually our sister director at the Human Performance Wing is pretty intimately involved with. And so as part of the aircraft decontamination team, they've actually been evaluating using high heat and high humidity, and in some cases just high heat, to inactivate SARS-CoV-2, the coronavirus. That's the cause of the current pandemic. And they've actually shown that they have some pretty good results as far as being able to decontaminate the virus. So what they're working through right now is how high of a heat can the different aircraft that we use tolerate, but also potentially how low of a temperature can you use to deactivate the aircraft, right? So the lower you can keep the temperature, the less stress you have kind of on your materials and things like that. So if you've ever had like an old car with vinyl seats that's, you know, been cooked in the sun every summer, you know, that vinyl starts to wear out and fade and crack and things like that. So those are definitely things we don't want happening to the inside of our aircraft. So.
No, I can definitely sympathize. Back in high school, I used to, straighten my hair, heat it up a bit after the shower, so I can understand how some heat resistance is important. We think about that in terms of humans, but materials on aircraft, many people don't consider. So that's a big aspect of this. And the fact that we're pushing forward with those technologies to fight COVID is inspiring. So speaking of that, for both of you, how's your position? Has it changed at all during the pandemic? Have you had different responsibilities appear that you wouldn't have had beforehand?
Yeah, I think definitely. So one of the interesting things is that Caitlin and I have been working together for a couple of years on microbial corrosion, and Caitlin and her lab has a long-standing understanding of different microorganisms that grow on aircraft, that grow in fuel. How do you identify those? How do you mitigate those? And I think that we're lucky in that was part of our day-to-day job prior to this, so we can kind of incorporate that. But also, I do think that this has made it come more to the forefront. So prior to this, there were some other things that we were doing, and right now, most of my focus is on this aircraft decontamination. So it's certainly been different from that aspect, as well as, working from home and how do we coordinate testing out of laboratories when I'm at my house. And so that's something that we had to work through as well.
And so I would just chime in that I think one of the great things about working at AFRL is just the diversity of scientists and engineers we have. And I think, our response to this whole pandemic has really highlighted how our diverse expertise, and then also just how great everyone has been about working together and bringing all of their different technical areas to bear on the problem. And so it's been great. So Rachel and I have been working together for a long time on aircraft or microbial contamination of aircraft materials, but to have her as a partner before the pandemic struck has actually been great because she can reach out to the whole materials community that we have and really coordinate and bring those experts in. So if I have a technology that I think is promising, she can bring in experts from all of the different fields, coatings, metals, electrical, and we can get their feedback on whether or not that, even though it kills the virus, is it going to be safe and compatible with their aircraft. And I would just say the other thing that I've really appreciated, even though this is kind of an unfortunate time for the United States and the world, is just getting to work with the broader Air Force. And I guess to feel like we're having a direct impact on helping our airmen execute their mission.
Great conversation, Ken. Let's talk to our next guest now. So now we're here with Dr. Chuck Ward, who is the chief of our Manufacturing and Industrial Tech Division. Thanks for joining us, Dr. Ward.
Oh, my pleasure.
Yeah, so can you describe what your role is of the chief of the Manufacturing and Industrial Tech Division?
So I lead a division that resides within the Materials and Manufacturing Directorate. It's comprised of 59 government people and a few on-site contractors to support us. We have two missions. One is a science and technology mission to advance state-of-the-art in manufacturing technology, supporting tech transition as well as manufacturing problems that programs of record encounter. And then our other mission is to look after the defense industrial base, and we work on behalf of the entire DoD as the Executive Agent Program Office for the Defense Production Act Title III program.
And that second piece is what we're really here today, what we're really interested in talking about, because this whole little program that we have going on right now, this recording is really about AFRL's response to the challenges of COVID-19 as we're in this global pandemic. And could you tell us more about the Defense Production Act? I mean, I've heard about it in the national news, but what is it? How is AFRL supporting the Department of Defense in that space?
Sure. There is actually three active titles for the Defense Production Act. Title I, which is prioritization. Title III, which allows the president to directly invest in industry of importance to national defense. And then Title VII, which gives us the CFIUS process and all. So Title III is what our division primarily focuses on. And again, it provides an ability, which is really unique, to target critical defense industrial-based technologies and manufacturing capabilities that are essential to the national defense. So in that context, we can invest in, for example, production capacity expansion of critical technologies and manufacturing capabilities over a very, very broad suite of technologies. We've done everything from lightweight ammunition to radiation-hard electronics for space applications. And more recently, within COVID, we've expanded out to the medical supply chain industrial expansion.
So DPA is important even when there's not a global pandemic going on. There's critical infrastructure and supply chains that we need. But now that we are in the midst of this pandemic, could you talk more about that, medical supply and infrastructure that we've needed during our COVID-19 response?
Sure. The typical year for Defense Production Act Title III budget that's appropriated and sent through OSD to us is about $50 to $60 million of investment opportunity. With the CARES Act that was passed in response to COVID-19, that went up to $1 billion. And
wow.
So, yes. So that was a kind of a shock for our team, but they really rallied to the challenge and just have done a tremendous job. About 900 million of the 1 billion was set aside for direct investment in maintaining or expanding industrial capability. So out of that 900 million, we put $213 million on a contract, or in particular an agreement, that was geared towards medical expansion. So it's clear at the beginning of the pandemic that we didn't have enough capacity within the US to produce critical medical items such as N95 respirators, nasal testing swabs for COVID-19 testing, and test kits, as well as the filtration media that goes into ventilators to make sure you're only getting good air in when you're on a ventilator. So we invested in 6 projects to expand the production capacity across those 4 general areas of medical supplies.
That's really amazing because, I'm hearing about these things on the national news, that I'm watching at night, or the local news even. This is in everybody's mind front because, we harken back to, we think about different war efforts where the industrial base was, brought together to help solve a problem for our country in a time of need. So this is really amazing that this is Afrl, playing a direct role in this. Is there a reason that, Afrl has the expertise to help execute these sorts of things?
Yeah, we've actually been the Executive Agent Program Office for the Defense Production Act Title III program for over 30 years now. A long time ago, they looked for the right home for DPA Title III, and they kind of did I'd say a test case, and the Air Force had the best operational model to execute the program. Another unique thing about the Air Force model is that, as I mentioned, I've got 59 folks in manufacturing and industrial technologies. We're the only service organization that organizes this way. So all the manufacturing expertise in the other services is distributed throughout execution organizations. No one else pulls them all together like us. So we've got 59 experts all geared up in manufacturing, who can handle anything that's thrown at them, from forging, casting, to transparencies, to electronics, directed energy, chemical engineering, you name it, we've got an expert on staff that can handle it. So it makes us uniquely qualified to be able to handle the breadth of programs that Defense Production Act Title III handles.
That's really great. I've said it several times during these interviews with our Afrl team. It's really reassuring that I know that I have smart people that I work with that are so dedicated to getting our country what it needs during this crisis. So thank you for joining us today, and thank you for your work.
Sure, my pleasure. Happy to be here.
What another great, insightful interview. We have such an incredible work base here and such intelligent minds working to really fight COVID-19 and Afrl. It not only makes me feel more rest assured, but shows our audience just what amazing work they're all doing.
Yeah, we have some amazing people working at Afrl. So let's go see what our last guest has to tell us. Dr. Kristen Duran, thanks for joining us.
Thank you for having me.
And today we're really exploring all the many things that Afrl is doing to help combat COVID-19 for our nation and for the air and space forces. You held just one kind of piece of this puzzle that we're doing. You are actually an aerosol scientist. Could you explain your background and what you do for Afrl?
Sure. I have a doctorate in chemical engineering. And during my doctorate research, I studied aerosols with an aerosol scientist at Case Western Reserve University. And one of the primary goals during that time was to interface aerosols with toxicology models. But I've leveraged the knowledge that I learned during that experience to study aerosols as an environmental stressor to airmen to evaluate their impact on airmen performance and health. And also extending that beyond just aerosols. In the general day-to-day job, we're also looking at all chemical classes of exposures and sometimes also physical exposures like noise.
And so you're part of the environmental characterization team in our 711th Human Performance Wing. And obviously, the general public has been hearing about aerosols in the news all the time. That's why we have concerns about what types of masks we're wearing, what actually leaves our bodies as we talk and communicate or cough or sneeze. So how does your team help the Air Force in this area with aerosols? What are you actually doing?
There's three main components to our work. The first is taking actual field measurements. So we take instruments out and without impacting the mission, we measure the properties of what's in the air, essentially. And then the second thing that we do is we build computational models so that we can characterize the distribution of contaminants in the air. And then the third thing we do is we leverage collaborations in order to develop new technologies. And in some cases, those are very specific for the Air Force. One example would be we built a comprehensive system to characterize pilot breathing air. Of course, that had very unique specifications since pilot breathing air has high oxygen concentrations and very low humidity, so sensors operate differently. So that's one example, and there's several other examples where we're actually developing new technology for aircraft applications.
And so right now in the fight against COVID-19, I imagine you're looking at, different aircraft and airframes and how we maybe transport patients that could be infected and how air flows. Could you tell us about that?
Sure. So in response to a request from U.S. Transportation Command, we're completing computational models that characterize airflow and bioaerosol transport on several different airframes. So that includes Air Mobility Command airframes, as well as one airframe that Air Force Special Operations Command uses to transport patients. And essentially what we have done is we went out into the field and we collected virtual geometries for these airframes using a laser scanning technology that we have, and basically built the virtual geometries, turned that into computer-aided design files, and then translated those into computational dynamics models where we can add boundary conditions for inflows and outflows, and then look at airflow patterns throughout the aircraft. And then one step further is to release bioaerosols at locations of interest and look at their distribution and their deposition on different surfaces.
So you'd actually see where aerosols would travel within different priority aircraft, basically.
Exactly. We're doing all of the aircraft that we were asked by Air Mobility Command, and we're just doing it in the priority that they would use them, basically.
So I'm glad you touched on that. The last question I had for you was about that, like about the reward, about working on this product and how the impact that a lot of this research has had. With your position, do you have any unique insights or anything that you've learned from fighting this pandemic?
Sure. So as an aerosol scientist, I think of bioaerosols, I think probably a lot differently than someone who hasn't thought a lot about aerosols might think about them. And so one of the things that's really interesting to see and observe in the bioaerosol transport models is the bioaerosols that have a size distribution that are representative of expiratory aerosols. Of course, there is a portion of those particles that are larger in size and will be affected by gravity and fall out of the air. But a large fraction of them, especially when you're looking on a number of particles basis, are very small. So they transport where the air transports. They don't fall out of the air. They don't necessarily stick to surfaces very well. So if there's an area of recirculation, there's an area of stagnation in any indoor environment, those aerosols will hang out for a long time. If the air hangs out for a long time, the aerosols do too. You can kind of think of them as more of molecules rather than particles. And so that is one of the big things that you can take away from these models is really observing that effect. It's important to move air if you're in an indoor environment, and if you can't move the air, then the personal protective equipment is really critical to prevent transmission. Of course, there's more to the story. We're looking at this from an engineering perspective. We're aerosol scientists and industrial hygienist type backgrounds. So there's an additional piece which would look at, okay, what does that mean for actual infection? And there's a lot of other pieces to that. There's the vulnerability of the individual. There's the dose that they're receiving. So just because there's a lot of aerosols, the viral load within each of those particles is really important. And that requires us then to take the models and interface with other expertise in order to bring that to the full story.
Well, it's great to know that we have experts like you, your team, and others at Afrl really helping keep this fight unfair in many ways and helping transport people safely and getting correct models to show the impact COVID-19 can have. So thank you so much for informing us, and thank you for what you do.
Thank you.
Hello, everyone, and thank you for watching all the way through. It was quite the journey and quite the pleasure to run this event. We learned a lot from our team of experts and really saw how Afrl is keeping the fight unfair when it comes to the COVID-19 pandemic. If you have any further questions about what we're doing and about COVID-19, visit our website at afresearchlab.com or check out our social handles at afresearchlab. Make sure to stay tuned to our podcast for more information surrounding the pandemic, those fighting against it, or just research happening around the lab. And hey, stay curious.